Let's talk a little bit now about supervision requirements specifically for advanced practice providers. For NPs and PAs, there is something that you guys are probably aware of, and that is collaborations or collaborative agreements. This is different or separate from medical directorship. So just because a physician is overseeing your clinic as a medical director does not automatically mean that they're also a collaborating physician with the NPs within that practice. So it's important to make sure that if a nurse practitioner or PA is in a state that requires them to have a collaborative agreement with a physician, that is in place before they start practicing. Many times, collaborations also require chart reviews. That is mandated in most states where collaborative agreements are in place. And there are also delegation rules for injectables and lasers, which I'll delve into a little bit more in the next few slides. And it's important to know your state-specific rules because the rules for collaboration and delegation vary. And so, again, it's very important to know, do you have to file with the state when you have a collaborative agreement? Do you not? What's the number of charts that need to be reviewed? Is it 10%? Is it 20%? Does the physician also, sometimes depending on your state, may have to meet with you once or twice a year? So those are all things that you need to know. And in certain instances, if you're prescribing medications, there may need to be a delegation for prescriptive authority to allow the advanced practice provider to prescribe certain medications. It may be all medications, it may be controlled medications. So you really need to know what the rules are before you start. In addition to that, in some states, there are limits on the number of providers, either total number of providers or full-time providers, that a physician may oversee at once. So you may want to work with a particular physician and they say, sure, I can be your medical director. But it's also important to know that if your med spa has advanced practice providers that need a collaborative agreement, it's important to know whether or not that physician has room to take on more providers, and they may not, in which case you may need to then work with a completely different physician to be your medical director. So that's a consideration that you have to be aware of before you sign up with a particular medical director who's also willing to be your collaborating physician. And again, there are state-specific documentation standards for collaborations.